In this video, I'm going to be talking about an orbital blowout fracture. Now, what does that even mean and how does that even happen? So, you've got the skull, which is a collection of bones and plates and different things that kind of keep your head and brain and everything in check, basically, as far as keeping the structures, the organs, everything from your eyes to your tongue to your brain to your brainstem, everything else in there to just keep it locked into place, basically. So what can happen is sometimes, let's say there is a traumatic injury, whether you get punched in the face or a ball hits your eye or you even get in a car accident or something to that degree that can be a blunt trauma issue to the eyeball. Well, there is a collection of bone plates surrounding the orbit that the eyeball sits in the eye socket, basically. And if there's enough trauma, one of the weakest components of the orbital structure within which the eye sits in the socket is the orbital floor, located right down about here or so. It's an incredibly thin plate of bone that you give enough blunt trauma to the eye, sometimes the eye can drop down inside of the socket, which can lead to double vision, which can lead to eye strain, which can lead to orbital muscle entrapment, which can lead to headaches, which can lead to a whole bunch of other things that will require surgical fixing in order to get things back to where they need to be, basically, to get the muscle straightened out, to get the eyeball back up in the socket, to repair the orbital floor, which is that thin piece of bone plate that the eyeball sits on top of, because it doesn't take a lot of force to drop the eyeball down inside the socket, which means your eye could be literally sitting down inside your orbital socket, basically, or below the orbital socket in this case. So a lot of times, whenever this happens, this can cause a lot of vision problems and a lot of issues for someone, which a lot of times when we see them as optometrists, there's nothing we can really do to fix it as far as the surgical component goes. That's where an ophthalmologist would come into play in order to fix that orbital floor blowout fracture. We call it a blowout because literally the eye is blown down and out inside below the orbital socket, basically. Extremely devastating, but easily fixable, but it just does take some acute awareness to be able to see if you have experienced anything like that and to get seen by the right professional to where this can be easily rectified and taken care of and you move on with your life, basically. But there's different structures and different plates and different bones around the eye socket itself. It's just that orbital floor is one of the weakest components that when you throw trauma, when you throw gravity, when you throw all this other stuff into the play for what can cause the eyeball to drop down below the orbital socket, that's what happens whenever you have an orbital blowout fracture.
In this next segment of the video, I'm going to be talking about recurrent corneal erosions and what an 8-ball hyphema is. So what exactly is a recurrent corneal erosion? Ooh, it's really bright. Well, a recurrent corneal erosion is what happens when a certain layer of the cornea, in this case the epithelium primarily, turns over too quickly. So there can be different genetic conditions, there can be previous corneal abrasions, there can be certain things like epithelial basement membrane dystrophy, different things like that affect different layers of the cornea depending on what dystrophy you have, that can cause the epithelium to regenerate and turn over too quickly. This is like shingles falling off the roof of your house and not really anything but being done to replace the shingles of the roof. So what does that mean? That can mean that this person can experience a high amount of pain, a lot of vision loss, sensitivity to light, and inconsistent blurry vision throughout the day because their cornea is not right. Therefore, the tear film will not be right because the tear film consists of oil, water, and mucus, and all three, let's try that again. Oil, water, and mucus, and those three fluids have to be very full and consistent in order to give someone clear vision to let them see far away, read up close, different things like that. And recurrent corneal erosions can be tricky because historically it's been salt water, more or less, that's been used to treat these recurrent corneal erosions. But there's different technologies and things available now that allow the corneas to be restored, inflammation to be removed, and things to be managed better. You can't permanently fix them, remove them at the time of the making of this video because there's still genetic components that might exist that allow this to develop, but you can do things to manage it more effectively and to allow someone's pain to go down, allow them to see better, allow that tear film to come in a little bit more full, different things like that. So it's like the cornea is not full and it just keeps breaking off because the cornea needs to have 78% water content in it at all times. That's the magic number that needs to be able to stay consistent. So if the water goes up too high or if it goes too low, that's what can give someone some problems with those cellular layers missing that water content. So a lot of times in recurrent corneal erosions, you may have heard me mention that we use salt water to kind of help manage the corneal layers and the water content more effectively. Well, in some conditions, that the corneal layers have too much water in them, that's what the salt water does. It draws that excess water out to regulate and maintain that 78% hydration osmolarity content, basically. So that's recurrent corneal erosions. Recurrent corneal erosions. Trying to say that 3 times fast. So let's talk about what an 8-ball hyphema is then. So this is a very weird condition. So a hyphema is what happens when blood fills the anterior chamber of the front of your eye. So this is where the color portion of your eye, the iris is, and eye pressure typically drains out through the side of the iris called the trabecular meshwork, and it just drains out and goes to the rest of your body to be recycled, regenerated, made into new eye pressure fluid, also known as aqueous humor. But what an 8-ball hyphema is what happens whenever the hyphema, the amount of blood, fills up that complete anterior chamber 100% to where it literally looks almost like you're looking into an 8-ball, like those toy magic 8-balls basically. It has that kind of an appearance to it with as much dark, dense blood that's in there, which you would need to see an ophthalmologist as soon as possible to help fix and rectify that condition. So you can have red blood cells. You can also have white blood cells. This, in this case, is called a hypopyon. So a hypopyon is what happens when the anterior chamber starts to fill up with white blood cells due to some type of trauma or a massive infection or something to that nature that's allowed this to take place. Whether it's some type of bacteria got in there and a white blood cell response is just pooling at the bottom of the cornea and the iris, and it's just blocking up that trabecular meshwork channel. This will cause the eye pressure to increase over time, give someone vision loss, can lead to glaucoma, can lead to a lot of pain, can lead to a lot of problems that, if not solved quickly and effectively, will devastate someone's vision and can permanently alter and change their vision. Those are some top conditions that are very concerning and need urgent care in order to be able to save the eye, save the vision, and make sure nothing is permanently altered or changed as a result of the pathologies that have taken place in all of this. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications and to learn more about your eyes. I'm Dr. Bryce Heffington, and we'll see you next time.